the self-care part of
Mm-hmm.
managing anxiety, it's teaching them to know so much of what you're talking about. Tell me about how you talk to your families about the need for self-care and
Mm-hmm.
that sort of thing.
Yeah. So there's a whole chapter in the anxiety audit about this busyness culture that we have,
Yes.
and how so much of the time we see that as a sign of status, right? The busier we are. Like when you run into your friend and you're like, oh my gosh, how are the kids? Oh my God, life is so crazy. Oh, my life is crazy too, right? We never say, oh no, we're coasting, right? It's pretty cool.
Yeah.
I'm not doing too much. We never
Right.
say that. We do that humble brag about, oh my gosh, so stressed, so crazy. It really is kind of a badge of honor. The distinction that I make for adults, the difference between self-care and self-medication. So the way I see self-care is that it is a consistent practice of the things you do that you know are good for your mood in particular, because mood management.
Yes.
So I will ask people, I ask this to teenagers a lot, but adults as well. I want you to think about 3 categories. One category is, what are the things you know that make your mood worse, that make you feel lousy, right? Your operating system. I know the things, you know the things. What are the things that you do that make your mood better, right? Is it going for a walk? Is it getting in the sunshine? Is it exercising? Is it getting enough sleep? Is it blah, 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 blah. And then the third category, which is super important, particularly for teenagers, is what are the things you do that make you feel better in the moment, but bad long-term plan? Because I
Interesting. I
think a
like that.
lot of the self-care language,
Yeah.
right? When I see, like, I've had it with the mommy wine culture, looking at the statistics about women and alcoholism and et
Oh my
cetera,
goodness.
right? But there's a lot of sort of like, oh, self-care for me is just, having a margarita at the end of the day. Bad long-term plan. So when I look at self-care versus self-medication, self-care is consistent, happens over time, we can bank on it, and you never feel regret after you participate in some sort of self-care. You never say, oh, I can't believe I went for a walk with my friend, right? Oh, I can't believe I got a good night's sleep. What was I thinking? But with
Can't believe I had a date night with my
yeah,
partner.
right.
I
Why?
can't
Yeah,
believe that I
right,
slept an extra hour on
right,
Saturday.
right. Why did I go to yoga, for God's sakes, right? But with self-medication, we get that regret. Oh God, why did I stay up so late binging on that Netflix show? Or, oh, I shouldn't have eaten all those Oreos. Or, you know what, I really just wanted to get a little break and I went out and I spent too much money and now I have to go back and return all those clothes I bought. So self-medication comes with regret. Self-care is really you learning about you and committing to doing things again in a consistent basis. A bath once a month might feel nice, a bubble bath, but that's not really self-care. That's kind of giving yourself a treat. But making sure that 3 times a week you go for a walk outside, or making sure that every morning you fill in the blank. That's what we talk about with self-care. Mood management, anxiety management, depression management, however we're looking at it, is really about small things that add up consistently over time. And I think one of the messages that I really want parents to hear as they're dealing with all of this in our crazy lives is that small things do matter. So you don't have to overhaul your whole life to make a difference. If you just started, if the one thing you did was to pull out your worry, own it, give it a name, and tell your parents to call you out tell your kids to call you out on it, that would make a huge difference in your interactions.
And this also leads to the thought of talk about your worries to your child. There's a lot of parents that don't want to share, that
Mm-hmm.
they have this like pedestal. I don't worry. I don't, I want,
Mm-hmm.
it's not good to worry. It's
Mm-hmm.
not good to feel anxious. And they don't
Mm-hmm.
want their children to know. And that scares their child because they feel very alone. And
Mm-hmm.
so the parents that share their experiences and say, that was scary for me,
Yeah.
and kind of relate to them, that like opens the child up to be able to express themselves more instead of pull
Right.
away.
Right. If, with the one caveat, is that if it's safety chatter and if the parent is saying, oh, that was so terrifying for me, That was awful. I can't believe, right? So then they're just showing their kids how to worry. But you might say, "Oh, I know. I had to go to the dentist and I never had a root canal before, and I'll tell you I was a little nervous before I
Right,
went in."
exactly.
Yep, and I didn't like it. I didn't enjoy having a root canal, but it was really the good decision for me to make because I got to take care of my tooth or whatever it might be. Like, you come home from work and this is again at the dinner table, right? How was your day? Oh, it was pretty good, but I had to have this conversation with my coworker and it was a little uncomfortable because there were some things she was doing that were sort of making my job harder. And I was nervous when I went in. My heart was pounding. My tummy felt a little,
Yep.
butterfly. But it was important for me to take that action. So we
Yes.
want to give our kids kind of the sequence of I had to do this thing. I felt nervous. I problem solved and I was able to make some progress. We want them to see the through, right? Not just stop at the worry.
Absolutely.
Yep. Yeah. Modeling is so,
Yes.
so important. It is
So
so,
important.
so important.
It's
Yeah.
so important. It's such a big part of just this whole process of modeling.
Mm-hmm.
Your children pick up, and for kids with selective mutism, the majority are very sensory sensitive.
Mm-hmm.
They're very emotionally dysregulated at times because they have the sensory sensitivities. So
Mm-hmm.
they're more perceptive, they're more aware.
Mm-hmm.
And with that inhibited temperament and more likeliness to not want to engage, it's like it's magnified for so many. And because of that genetic component, it's the parents are feeling it too. So the kids are
Right.
modeling their parents that don't want to go out to a party or they don't want to go out and do things. And that's one of the challenges is if you've got to go out and do. And so working with those parents that have the anxiety themselves, the
Mm-hmm.
social anxiety piece is a whole challenge in itself.
Yeah. Yeah. I really can't, I really can't get very far if I'm dealing with an anxious family and there's an anxious parent. I will tell you, it is very rare for a very anxious child to come into my office and have two really chill, laid back parents, right? That
Right.
is not the way it goes.
No, it
Um,
does not.
but it is very, very hard for me to work with a family if the parents won't own their own stuff. Right? If a parent is
Exactly.
in denial about it, if a parent isn't willing to model, if a parent isn't able to say, oh, and that doesn't happen. It's much more frequent that a parent says, oh, I totally get it. I felt the same way when I was a kid, et cetera, et cetera. But when parents are refusing to acknowledge either
No,
their part of it,
you're absolutely right. I was just telling
yeah.
my office manager this. A family that had come had been all over for treatment. Whoever they saw was not were not helping them
Mm-hmm.
understand their own fears and anxiety. And as soon as we started to talk about it and the parent changed the way she responded, how she reacted,
Mm-hmm.
the child just modeled that. And it
Mm-hmm.
was almost incredible the change that they made
Right.
versus the parent that comes in, cure my child and not take any responsibility. And there, it's impossible to work with a family that isn't willing to take your expertise to change and change their ways.
Right. And I'm sure you see this all the time because I certainly see it, is that if you've got a parent who's anxious about their child's anxiety, be it selective mutism or social anxiety, and they start saying, you know, oh God, you've got to do this. You guys, that just increases the pressure
Oh,
on the kid. So if you want to shut down a kid with some social issues,
yeah,
put social pressure on them, right? It's sort of the same.
exactly.
It's sort of the same way where we tell kids. I go into schools, and I'm sure you say the same thing. Is that if we're working with a kid with SM and they use their voice, don't throw them a parade,
No,
right? That's their like they don't want everybody to go, oh my gosh, Hannah just talked, right?
right.
So it's a lot of coaching and a lot of giving concrete information to parents who
This
again
was
are
so
trying.
fun.